Respected audience, this is Naushaad Khan, attorney at law, adjunct professor law. In our previous part, we have discussed medical negligence and one of the key area, that is criminal negligence. In this program, we will talk about a test which relates to the ascertainment of criminal negligence. Universally, that test is known as BOLAM test, BOLAM. This stands for a proper noun, and in this test actually, the BOLAM test primarily enumerate that the doctor would not be held liable if he had acted in accordance with the practice accepted by the reasonable body of medical men skilled in the particular act or skilled in the particular field. It is the adherence to clinical practice guidelines or the practice which existed during that time, and the doctor in question has followed the same. So basically, these guidelines, if doctors' acts are within the parameters as defined and designed by the relevant guidelines, then of course BOLAM test will act as an umbrella to safeguard if there is an allegation of medical negligence. As a matter of fact, normally known medical complications do not constitute medical negligence. So if patient has developed certain ailments on account of known complications or patient dies, we cannot hold responsible to the healthcare service provider or healthcare establishment, because on account of this BOLAM test, which is given reverence by the courts of law worldwide and especially in Pakistan, of course this BOLAM test is having its key importance. And if the healthcare commission and the panel of commissioners, they ascertain that the allegations against a healthcare service provider or healthcare establishment are unfounded, baseless, or the complications alleged against the doctor which are developed after the surgery or after the resection of liver or other human organs, that cannot make the doctor liable for medical negligence, because on account of BOLAM test, the known complications or adherence to the guidelines does not constitute any negligence. Furthermore, in Pakistan, in all 4 provinces, we have healthcare commissions. And if I quote an example of Punjab, we have Healthcare Commission Act 2010, and in this act there are enabling guidelines or regulations. One of the relevant guidelines based on regulations are minimum service delivery standards. So MSDS, minimum service delivery standards, if doctors are showing adherence to these guidelines, they can of course safeguard themselves or their acts or omissions on the basis of this BOLAM test, that they've been following the guidelines. But if the result is otherwise, they cannot be held responsible, or they cannot be held responsible in terms of medical negligence. Thank you very much.